This segment of Delmarva Life is sponsored by Delmarva Dental Services.
It's a date that's probably penciled in on your calendar every year like clockwork. But it's not a birthday, holiday, or anniversary. It's your annual physical checkup.
Yeah, it's a chance for your doctor to monitor your health, address any health concerns, and identify any issues before they get bad. In addition to your primary physician, there's another doctor you should see at least once a year, your dentist. And with November being Mouth Cancer Awareness Month, DelmarvaLife's James McDonald took a visit to one local dental practice to discover the importance of a regular exam and how their team of doctors is able to identify oral cancer before any serious symptoms arise.
When you sit down in the chair at Delmarva Dental Services, their hardworking team of dentists are paying attention to more than just your teeth. They're trained to spot things you might not see yourself, like oral cancer.
Oropharyngeal cancers are a group of cancers that are either in the oral cavity, so in the mouth that we think of, or in the pharynx, which is part of the throat, beginning to lead down further into the body. So they are all those cancers that affect those areas.
Dr. Lee Alke says these cancers grow slowly and often don't show symptoms.
Oral cancers are often not diagnosed very early because they are slow growing and they're typically asymptomatic. So the majority of cases are not diagnosed until a patient is somewhere over the age of 60 to 65 years old. It's pretty rare to find it in younger people.
She says men and older adults are usually at higher risk. Lifestyle factors can play a role too.
Some big ones in terms of oral cancer are, of course, going to be tobacco. Everybody thinks that when they think of lung cancer or oral cancer. And by tobacco, that could be cigarettes, that could be cigars, that could be pipes, it could be vape even, or e-cigarette, which of course is newer and not all the studies are out. However, it still provides those chemicals and the heat that goes into your body, creating inflammation, which is one of the things that changes cells and allows them to become affected by things like cancer.
Dr. Alke says smokeless tobacco can also damage tissue, creating changes where cancer may develop.
It's not necessarily the nicotine that creates a problem, but smokeless tobacco is certainly a problem. And what we'll see with that is actually changes in the tissue. So you could create like folds in your cheek tissue. You can create gum recession from that. And those areas can become keratinized, which is a change in the cellular pattern, and therefore cancer can begin there.
At Delmarva Dental Services, oral cancer screenings are part of every routine exam.
For every patient, whether they're a new patient, an emergency limited exam patient, or just a recare patient, is the oral cancer screening and soft tissue exam. So we are palpating, we are feeling things from the outside along their face, jaw, down into their neck. We are also lifting their lips and cheeks out, looking on all of those mucous membranes within the mouth. We are holding their tongue out with a piece of gauze, looking on the surface of the tongue as well as on the floor of the mouth and the sides of the tongue. And then, of course, we're checking their teeth and their gums.
She says early detection of these cancers make a big difference in treatment.
We have had to, unfortunately, tell some patients we really feel strongly that you need to go and have this biopsied. And there have been many patients that have, unfortunately, been diagnosed with oral cancer, and many of it is squamous cell. And many of them have gotten the proper treatment, whether that's surgery, radiation, chemotherapy, combination of, and are still patients at the practice and have done very well beyond that.
Catching them early is the best way to prevent serious issues.
And having a doctor that is looking for these things, and if they even question a little bit, to take that next step and say, let's just, for peace of mind, be sure that we know we've ruled this out. I would suggest to anyone to please get a dental evaluation. Even if you are a dentulous, you wear dentures, it is still possible to have lesions occur in your mouth, on the palate, in your throat. And again, these are all affected by different risk factors. And it's something that can be easily treated and prevented if we do catch it earlier. So I would just urge people to please, get that evaluation and find out.
Because at Delmarva Dental Services, every visit is a chance to keep your mouth healthy, spot issues early, and leave you feeling confident in your smile.
And Dr. Alke tells us that getting x-rays aren't just to see if you have a cavity, they can also be helpful in detecting oral cancer. A tumor or cyst can be picked up radiographically where it might not be clinically visible. And now I know why my dentist is always
Right.
you know, and looking around my tongue and everything.
Early detection, without a doubt, is a key. We keep hearing that.
Sure
And
is.
even when it comes to your mouth as well.
Yep.